Hi, I'm Dr. Julie Steinauer, and the question that I get a lot is, when can I quit doing my maintenance vision therapy? Well, let's talk about that, but first of all, let me tell you how you can connect with me. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you can either fill out a questionnaire, or you can click on the schedule a consultation button. Now let's go back and talk about, when can you stop doing your maintenance vision therapy? Well, never. How about that? Never. When can you stop brushing your teeth? Never. When can you stop wearing your braces or your retainer after you've had your braces off? Never, right? Unless you want your teeth to go back. The reason why we say to continually keep checking your vision, and years ago I didn't do this either. I didn't suggest it or recommend it in any way. But because of there being so many visual demands on the vision system these days, more than usual, everybody's got an iPhone or an Android, everybody's got a tablet, or they're on a laptop. Everybody is working on devices all day long, even kids, even at young ages. So we want to make sure that you maintain good visual skills, good binocularity skills after you've stopped any type of vision therapy program. Just like after you've worn your braces, whether you did that for 2 years or whether you did it for 5 or 7 years. At the end of that, you're going to talk, chew, drink things, right? Your mouth is still going to be moving. So we want to make sure that you maintain a proper alignment of your teeth. And we want to make sure that you maintain a proper alignment of your eyes in a good binocular vision system, which we've set in place after therapy. So you want to continue to work on things. Now, it doesn't necessarily mean that you have to continue to do things at the same pace that you did when you were in therapy. So let's say in therapy is 30 minutes a day, 4 or 5 days a week of working on activities. And maybe an hour in office, which is what we kind of suggest and recommend and require actually for our therapy program. So at the end, it might look more like along the lines of 15 minutes once a week. And then once you've gotten to a healthy maintenance area, it might look more like 15 minutes once a month, just to continue to check up and make sure that your brain is, processing vision and aligning the eyes the correct way. It's not too much to ask for, really, after everything that you've gone through to maintain, or gain, I should say, good binocularity. It's really not too much to ask that you maintain it for a period of time. Inevitably. Okay. All right. So I hope that you found this information helpful. Many people do ask, should I quit after 6 months? No, you shouldn't. Do you want to quit working out after 6 months? Do you want to quit eating healthy after 6 months? Do you want to quit, again, brushing your teeth or wearing your retainer after 6 months? No, you don't. You want to continue to maintain good visual habits. So continue to work on those even after you've graduated. Now, if you like this video, hit the like button, hit the subscribe all button if you have not done that, or bell icon. If you've not done that yet, please do so. And that way you don't miss any of our awesome videos. Thank you.